Hey guys, welcome back to Care Zone. A recent report about COVID-19 vaccines has it that about 1 million doses were destroyed because they got expired. There may have been a lot of factors that led to it, but the part I will be talking about today is that of reluctance by some persons to take the vaccines. Their reasons for not taking the vaccines are not baseless, but I'll be taking 10 frequently asked questions that can help you to make up your mind about taking the vaccines or allay your fears about them if you have taken the vaccines already. This is still Care Zone and my name is Grace. If you have not subscribed, please hit the subscribe button and turn on your notifications so you don't miss my videos at any time. Let's jump right in and answer those 10 frequently asked questions. Can I get COVID-19 again if I get vaccinated? The answer is yes. The function of the vaccine is to train our body's immune system to recognize that virus, the COVID-19 virus, and to be battle ready to fight it if we get exposed to the virus. So the objective of the vaccine is to prevent serious illness from COVID-19 if we get exposed to it, to prevent hospitalization, and to prevent death from COVID-19. So it does not necessarily prevent us from getting the virus again, but it does help to make our bodies battle ready to fight the virus if we are exposed to it. So the objective is that if you are vaccinated and you get exposed to the virus, it will just likely feel like you got a cold and you recover without severe symptoms, hospitalization, or death. That's the objective of the vaccine. Which of the COVID-19 vaccines are approved for use in Nigeria? Well, the WHO has approved 7 vaccines globally, but various countries are also carrying out their own individual evaluations of these vaccines, and Nigeria is one of them. They are doing this through NAFDAC. And after evaluations and testing, Nigeria has prioritized the use of AstraZeneca, Pfizer, Johnson & Johnson, and Moderna vaccines. So these are the ones that are primarily in use in Nigeria and have been approved by NAFDAC. Which of the vaccines is more effective? Well, I would say none of them is more effective than the other. All the vaccines were evaluated and tested before approval, and they were tested with different populations at different times and at different waves of the pandemic. Some were tested in the heat of the pandemic, while others were tested when the pandemic was gradually being controlled. But one thing that is sure is that the vaccines, all of them, are meeting that common objective, which is to keep people alive, to prevent hospitalizations, to prevent death, and to bring the pandemic to a possible end. So any of them you take will meet that common objective. Can I still get vaccinated if I have a pre-existing condition? Yes, you can. If you're hypertensive, you're diabetic, you have asthma, kidney disease, whatever the pre-existing condition you already have, as long as you're stable and you're managing your condition, you can get the COVID-19 vaccine. Should I stop my medicines because I want to take the COVID-19 vaccine? Not necessarily. During the evaluations and clinical trials with the COVID-19 vaccines, the subjects or the volunteers were people from various populations, people who already had pre-existing conditions like hypertension, diabetes, asthma, kidney, liver disease, and they all did well during the trials with the vaccine. So based on that, it is possible for you to still take the vaccine even though you have a pre-existing condition, and even though you are already on your medications, you do not have to stop them because of the vaccine. But it may be necessary for you to let your doctor know that you are about to take the vaccine, so that if there are other medical advice that may be necessary for your condition, these will be given to you. Who should not take the vaccine? Almost everyone can take the vaccine, but it may be necessary to consult with your doctor if you have had severe cases of allergies in the past with vaccinations, and also if you have gone through the ingredients of these various vaccines and you are allergic to any of the ingredients of the vaccines, it will be necessary for you to consult your doctor about it. Also, those who are immunocompromised and very frail may need also to consult with their doctor before taking the vaccines. Currently, children and adolescents have not been prioritized in the global vaccinations, and that's because they have milder infections with COVID-19 compared to other adults, health workers, elderly patients. And so, not that they don't need it, but they are not the point of interest for now. Should I take painkillers before going for the vaccination? Well, it is not advised for you to take painkillers before going for the vaccines. This is because we do not know what effect those painkillers would have on the effectiveness of the vaccine. Some of the painkillers are anti-inflammatory drugs and have a way of working on the immune system or the inflammatory responses from the immune system. So in order not to alter the activity or the effectiveness of the vaccine, it is best to not take any painkillers before going for the vaccination. However, after taking the vaccine, if you come down with some side effects, you can take those painkillers like paracetamol at that point. But if you do not even experience any symptoms, there will be no reason, no need for taking any medicines at all. What are the side effects I should expect after taking the vaccines? Well, for some, they would experience pain in that arm where the injection was done, tiredness, muscle pain, headaches, joint aches, in fact, general body pains. But these vary from one person to another. My mother-in-law did not have any side effects after taking her vaccine, but when I took mine, I came down with the side effects. I had body pains, I had fever, and this lasted for about 3 days, and after 3 days I was up and about. So I also used paracetamol to relieve my symptoms. So this may be the case for you, or even better. Please note that these side effects are supposed to get better every day. So if it's getting worse after a few days, then there's need for you to report it to the hospital. It might be a sign of something serious. Should pregnant and breastfeeding women take the vaccine? Well, some countries are going on with it, but Nigeria has not adopted it. Some other countries like Trinidad and Tobago are vaccinating pregnant women who have passed their first trimester. And also, here in Nigeria, it has not been adopted. Though there was a recent report that Lagos wants to start vaccinating pregnant women and children because leaving out that population is creating opportunity for further spread of the virus. This has not been implemented, but I believe it's being evaluated for possible adoption. So currently, pregnant women are not being vaccinated in Nigeria. Is the vaccine safe for me? Well, all drugs, even our best friend paracetamol, are poisons if they are used irrationally. The vaccines were evaluated, tested in real subjects or volunteers before they were approved. And as they are being used, they are also being monitored for adverse effects. So, I hope this video has answered some of your questions about the COVID-19 vaccine and possibly might help you make up your mind about taking the vaccine. Well, one of the things that also drove me to take the vaccine is that I want my life back. I want my interaction with my friends and family. I want to go out freely. If you're vaccinated and I am vaccinated, we can confidently move about our daily activities with less to worry about. It doesn't mean that nobody would ever come down with the virus again, but at least the fear will be minimized. If you have more questions, please feel free to ask in the comment section, and I'll be willing to respond to your questions. And remember, this is still Care Zone, and I am Grace. Don't forget to subscribe and watch out for my value-packed health information video. Till I see you again then. Bye.